Two more high-profile universities are scrapping plans or delaying them, which includes in-person classes because of coronavirus outbreaks on campuses. Notre Dame is moving classes online for at least 2 weeks on Monday, just 1 week after classes began. 19% of the students on campus tested positive for the disease. The cases have been linked to at least 2 off-campus parties, and officials warn if the outbreak is not contained in 14 days, the school will have to send their students home. Meanwhile, Michigan State is asking students who are planning to move into the school's dormitories to stay home. The campus has not seen an outbreak itself, but says it will shift to remote learning when classes resume for the fall semester. For more on this, let's bring in ER doctor and Yahoo News medical contributor, Dr. Dara Kass. For more on this, let us bring in ER doctor and Yahoo News medical contributor, Dr. Dara Kass. Doctor, good to have you here with us. The CDC guidelines recommend against screening all students for COVID-19. Instead, it asks students, teachers, and staff to conduct their own health assessments before returning to the classroom. What is the proper way to do that? And I guess more importantly, for parents out there who may be concerned, how effective is it since a majority of people are asymptomatic?
Right. So I think that actually the CDC is helping us streamline the effective measures against finding patients that have other viruses versus the coronavirus before they go to school. Remembering that if you screen everybody at the door of school, you're taking time away from learning. And really, are we going to find cases? What the CDC says is it's not recommended to screen on site because the symptoms of coronavirus, especially in children, can be as vague as headache, shortness of breath, cough, maybe not even a fever. So they're asking parents to screen children at home and keep them home for any infectious disease or symptoms of an infectious disease. Remembering that the best screening for the coronavirus is actually a test. So if a child does have symptoms of an infectious disease, upper respiratory disease, a normal kid virus usually, the best thing to do is get them tested quickly with a rapid turnaround, clear them when they feel better, and get them back to school.
Just in your professional opinion, I mean, does it make sense to open up these universities? I get all the arguments for the economic arguments, the arguments around sports, the real headaches that it's causing for international students. But I said this to another doctor yesterday. I have not been as sick as I was in college. In other words, like there were all sorts of things going on in college when I was, between 18 and 21. Broken bones. I remember there was a scabies infection that ran rampant through our dorms. I mean, it feels like college kids get a lot of things because we're all living together and partying together and studying together. Does it make sense, in your professional opinion, to open these schools back up if we're still dealing with this epidemic?
So I think your scabies infection might be a really good example of the stuff that happens in college dorms because people are in close proximity of each other when they're not in class. Notre Dame was remarkable because what they did to make their classroom safe was incredible. They put up partitions. They had incredible digital learning in the classroom. They even marked each chair with a number. So if they had to go back and contact trace students, they would be able to find them quickly. What I think that the colleges are not calculating for, with all respect, is the behavior of college students when they're not in their classrooms. And remembering that they're finally getting freedom for the first time, probably in 6 months, away from their family, their parents, oversight. And you can see by the rapid outbreak, this isn't just like a couple of cases. These are cases spreading like wildfire. The best analogy is what we saw in camps, these sleepaway camps with kids sleeping close together. Colleges just really need to acknowledge that the behavior of college students may be the undoing of the academic career of those students as well on campus.
Really important information there. One last question. Scientists are studying the different and unusual symptoms of COVID-19, like loss of smell. I remember in the early days of the pandemic, we hadn't heard that, at least as far as those of us who are in the journalism community. And then we started to hear that people were getting those types of symptoms. What can we learn from why this is happening? Do we know why it's happening? And does it give us any clues into understanding how the coronavirus attacks the body?
So it does give us clues into how the coronavirus attacks the body in a very interesting way. I myself had loss of taste as my first symptom that I could really say this was different than a regular virus that I'd had before. Remembering that it seems that it's the receptors, this ACE the enzyme that is present in your nasal tracts and in your nose passages in a higher proportionance than we otherwise thought, that may actually contribute to why this virus has a increased experience of decreasing smell and losing smell. And in the beginning, in March and April, we started asking patients as a highly sensitive screening method when we had no testing. If you've lost taste or smell, that would be enough to quarantine yourself from your family for 14 days. So I think it's helping us understand the pathophysiology of this disease. It is interesting. Most people get their sense of taste and smell back, but it is ENTs that are studying this. So it proves again how complicated this virus can be.
Dr. Dara Kass, so great to talk to you. Thank you, doctor. Appreciate it.
Thanks, Bud.